Hello and welcome to our new office. This is Pueblo Ankle and Foot Care's second office. As always, if you like what you see, please subscribe and even hit the like button and ring that bell. So thank you for being with us. The question came in, what about my big toe joint happened while I was playing football? It hurts. And unfortunately, in the process of going through that, I was really bummed out to get the question because usually this is an urgent thing that the patient should have actually contacted the office, gotten an appointment, done some x-rays, and so we could really go through what the severity of the injury was so that we could come up with a plan to help. But as far as turf toe goes, it's like that very hyperflexed joint and coming off of a line with a lot of force, and then on top of that having somebody else trying to tackle you and smear you into the ground, that is just ripe for a potential injury to that big toe joint. And that's what a turf toe injury is. In that turf toe joint, in the big toe joint, there are bones called sesamoids, and they are kind of like your kneecap. They help the knee to glide and that joint to really move smoothly. And so the sesamoid bones, there's a tendon that runs between them, and they're also located within a tendon. And when a turf toe injury happens, it messes with that dynamic, and unfortunately it requires a lot of rest. The patient is then likely doomed to future arthritis in the joint as well because the cartilage has been damaged in some way. And so really the key is to the acronym PRICE. P stands for pain medicines or anti-inflammatories, R stands for rest, I stands for ice, C stands for compression or some sort of ACE wrap around the area, and E stands for elevation. That needs to calm down that joint as quickly as possible. And then what we can talk about is with things like orthotics or possible injections, helping the patient to be comfortable until we really find the extent of the injury with a possible MRI. If there's been fractures of those sesamoid bones that I mentioned, certainly x-rays will pick up on that, but because it's really a lot of soft tissue injury, an MRI ultimately would be ideal, and then it's possible we may have to do surgery. So that is the turf toe situation. I hope that helps, and stay tuned for our next video.